there are different types of heart failure. So for example, there are patients that have heart failure with reduced ejection fraction, which means that the heart muscle is weak, or maybe it's dilated, it's bigger than it should be. Around 50% of heart failure patients that have something called heart failure with preserved ejection fraction, meaning that the heart muscle is actually quite strong, but it's stiff and it doesn't relax well. In a normally functioning heart, the heart relaxes. So the blood enters through the right atrium, it gets filtered to the right ventricle, then the blood gets pumped through the pulmonary artery to the lungs where it gets oxygenated, and then the blood with oxygen returns to the left side of the heart, to the left atrium, then the left ventricle, and then the left ventricle is the main pumping chamber of the heart, and that blood leaves the left ventricle to be pumped out the aorta to the rest of the body. And then the whole cycle starts again. Ejection fraction is simply a measure of the percentage of blood that leaves the left ventricle, or the main pumping chamber, with every beat. Even in the strongest of hearts, not 100% of the blood leaves the heart with every contraction. So somewhere around 55 to 60% ejection fraction is what we consider to be a normal amount of blood that's leaving the heart with every beat. If they have heart failure with reduced ejection fraction, that ejection fraction is typically lower. Not as much blood is leaving with every contracting beat of the heart. In people with heart failure preserved ejection fraction, their ejection fraction can be normal or even higher than normal, but then the heart doesn't fill properly, and so that can limit the amount of blood supplied to the rest of the body. In either scenario, the pressures in the heart circuit rise, and that's what typically makes people short of breath and sometimes makes people retain fluid in either their legs or their abdomen or in their lungs. Ejection fraction is one of many numbers and many parameters that we use to measure how well or how poorly a person is doing with heart failure. However, we do have many situations where medications and other types of interventions can increase a person's ejection fraction.